Code blue. Code red.
Code blue.
Code gray.
Code gray.
Code blue.
Code red.
Code red. Code gray. Facility alert. Fire alarm. 4th floor. Please avoid the area. Staff initiate fire alarm protocols. Hospitals and healthcare facilities around the country are reducing confusion by implementing plain language emergency alerts. Plain language emergency alerts eliminate the need for the current color-coded system, which can vary from facility to facility. It also reduces fear and confusion among patients and visitors. Instead of using code blue for a medical emergency, a plain language alert would be Medical alert, cardiac emergency, North Wing room 302. Cardiac team please respond. Instead of using code orange for a hazmat emergency, a plain language alert would be Facility alert, hazardous material release, 3rd floor laboratory. Please avoid the area while hazmat team responds. Instead of using code gray for a security issue, a plain language alert would be Security alert, security assistance, 5th floor west nursing station. Please avoid area while security responds. Plain language alerts require minimal training and, according to pilot projects, can initiate responses up to 7 times faster than the traditional color codes. For more information and training materials, visit the NJHA Emergency Management webpage at www.njha.com/plain-language-guidance.